Hello and welcome, everyone. Welcome. As you are logging in, go ahead and stay muted, and we're about to start. And the chat is open, so you're welcome to be active in the chat during our presentations here, and then last half of the session will be our Q&A, our live Q&A. So I'll just get us started here. So I'm Megan Kingsley Gale with the Hospital Handbook Project. The Hospital Handbook Project is hosting today's session, and this session is part of a longer series that we host that's called the Issues in Hospital-Based Practice webinar series. So today's session is on Medicare, the Social Security Act, and acupuncturists. And today is Wednesday evening, April 14th, 2021. And this is our live Zoom session. And like I said before, this is hosted by the Hospital Handbook Project for acupuncturists and their hospital sponsors. Our website is below there. And welcome. I am Megan Kingsley Gale. I am the founder and director of the Hospital Handbook Project, and this is a volunteer position. And a little bit of an outline of how we are set up today. We'll have an introduction, some information about the Hospital Handbook Project, and background on how this event came to be. And then today's session, just wanted to be clear that we will not be talking about Medicare billing, but I will tell you, for those of you, because there was a high interest in this, where to find the resource for the Medicare billing discussion that we're having in the Hospital Handbook Project community. Just to notice that this session is being recorded. And then, of course, at the end of my slides here, I will be introducing our guest speaker. So I believe that patients have the best access and greatest potential for team care coordination when integrative medicine is available where they receive healthcare. So what is the Hospital Handbook Project? So I won't go into the full presentation today. I'll just give you some of the highlights, but I highly recommend those of you who are brand new to the Hospital Handbook Project's work, or if you've been following our work but haven't seen our latest presentation yet, I did create a new presentation at this link, and this link is also in the chat. And it will be in the follow-up materials for this session as well. I recommend just checking out that 20-minute presentation. It is a much clearer presentation of what our goals, mission, and vision is, especially for 2021 and beyond. So who and what is the Hospital Handbook Project? We are the go-to resource for hospital-based acupuncturists and their program managers, hospital admin. We are a not-for-profit community resource project and a professional networking community. We discuss issues in practice and share innovations, solutions, and more. So just to clarify some language, when I say hospital-based, as the Hospital Handbook Project, this is how we define what hospital-based means. It means, I'm using the broad definition of it. So my definition of when I say hospital-based, it means someone who's working in a facility or organization that is accredited by or eligible for accreditation by the Joint Commission. The Joint Commission is a nonprofit quality assurance and safety vetting organization based in the US. It accredits a variety of organizations, including hospitals, ambulatory centers, facilities, county clinics, federally qualified health centers, federal health facilities, the Department of Defense, the VA, Indian Health Service, et cetera, and some hospice organizations. So our core focus in our vision is that we are the go-to resource for hospital-based acupuncture work, employment practices, and program standards. Our specialty is that we are a professional network community of hospital practice acupuncturists, clinicians, program managers, and more. So our vision is to support healthcare organization employment to be available as an employment option for licensed acupuncturists, to become the one-stop professional networking resource for hospital-based acupuncturist employment and program standards, and to be a resource for acupuncturists and program managers and connect them to resources, program examples, to share ideas, innovations, and help avoid the problem of reinventing the wheel. Become the one-stop resource for standards, examples, and professional networking related to hospital-based practice acupuncture or hospital-based acupuncture practice on hiring and retaining employees, what does success look like? Answering that question, such as, what does success for a functional rehabilitation pain management program look like? Or what does success look like for an inpatient acupuncture service, as well as clinical metrics for program managers. Our vision, we're working on becoming the authority on hospital-based employment best practices for acupuncturists and hospital-based acupuncture program standards. So we are a not-for-profit community resource project. As you saw in some of the materials when you registered, the suggested donation for today's session is $25. You can do that by subscribing to this month's Issues in Hospital-Based Practice webinar online resource module, which is $25 at that link. Or if you prefer just like a one-time support option, you can do the $25 support option by way of the virtual coffee support option on the website. And that's, you'll see that under when you're at the website under the support the project, you go to the website, click on support the project, and then you'll see this icon for coffee. And so you can support in different amounts of coffee. So again, the suggested donation for today's support is $25. So why today's session? As the LORAC said, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. So I have been interested in inclusion of acupuncturists in federal legislation for a while now. And what I have found is that when you're working in hospital-based practice or healthcare system practice, you will eventually come up to this issue of like, well, why can't we do that? And often what that comes down to is, well, you're just not included in that language, or you're not included in the federal legislation language that is that. And today we're talking specifically about Social Security Act and how that affects Medicare. So this, as many of you know who are here today, the Medicare decided to cover acupuncture for low back pain in January of, I think it was January of 2020. So please correct me if I have that date wrong. And so this fall, there was interest in the group. There's some confusion about how coverage was working. So I said I would host a community discussion session in November of 2020. And my background is, besides hospital-based practice, I have a background in medical records and then as well as I helped to write the documentation standards for the Washington State Workers' Comp pilot project for documentation of acupuncture for chronic low back pain for the workers' comp return to work model. And as well as I have practice writing documentation standards for the functional rehabilitation model for Army acupuncture pain management. So I thought at the November session, I would just talk about what those documentation standards were. But what I learned when we had that session is that there were more complicated things, like it didn't come down just to having a standard operating procedure and following that and following all the documentation protocols. There was more of a question of like how the language of Medicare coverage of acupuncture for low back pain was being interpreted by different Medicare contractors. And so what's good about having community discussion is that you get to talk about and have discussion and then find that you can narrow some of the questions. So if you can come up with good questions, it's easier to find answers for those questions. So the November discussion just brought up more questions that came up with the common issue that kept coming up was we need to look into like actually being recognized in whatever laws are involved that where Medicare recognizes acupuncturists as a provider. Because everything else, especially with the new coverage, is this really awkward workaround, which we knew, some of us knew that was coming, but this coming out was just like, okay, yeah, this is, even more of a workaround and unusual, unexpected interpretations of it and inconsistency. So I knew Kallie, our guest speaker, Kallie Byrd Guimond, was an expert in, or is an expert in federal legislation. So I invited her to come talk about how federal legislation works and how that's related to licensed acupuncture. So that's what she's here today to talk with us about. And so I just wanted to talk about some common themes. So when everyone was registering for the session today, some common themes I noticed in the questions you have for our speaker. So what is the legislative process, which Kallie will cover. Current Medicare coverage, billing issues, developing an SOP, language, etc. Charting and documentation, standards, evaluation and management codes, and credentialing. So those were common themes in the questions. Kallie's focus today is talking about the legislative process. Just wanted to note from all those registration forms, I know tonight we have representation tonight from all these different aspects of people working in healthcare and hospital system practice and how, so I know all of you are coming to this with different, different populations of people that you work with, but the Medicare issue and coverage by Medicare is a commonality that we all have. So we've got several hospital systems that are represented tonight. We got program directors and managers, as well as hospital-based acupuncturists. We have people working in children's hospitals. We've got colleagues working both inpatient and outpatient here today, as well as hospice and colleagues working at federal qualified health centers, as well as those working in the federal system. All right, so just a note about the Medicare billing process, because we did have a lot of questions come in on that. We are not talking about the Medicare billing process today. Today's session is focused on federal legislation. However, we do have a separate discussion, asynchronous discussion session going on about Medicare billing process. So if you are interested in sharing your success story of how your program is billing Medicare, or you want to learn from others, and so you can join this session. So if you're a hospital healthcare system acupuncturist program manager, so this resource is only for those of you who are working in hospitals or healthcare systems as an acupuncturist or program manager, only for that group of people with the Hospital Handbook Project community. You are welcome to join our ongoing discussion that started when we had that live session in November of 2020. So so if you're interested in that, just send me an email and I will send you the link. And we're really looking for people who do have success stories to share your success stories so others can learn and just share how things are working out and what has been successful, what has not been. It's just a nice wisdom share so we can all grow and learn from each other. So some ground rules for today. Stay muted as a default, and that just helps cut down on the feedback and improve sound quality for the recording. Please go ahead and use the chat. That is a great way to communicate while the speakers are presenting. When we do get to the Q&A session, please raise your hand, use that raise your hand feature when you have a question. Be respectful of the speakers. Notice that we are recording this session. I don't know if this recording will be available later, but I will at least create notes from this session. And when we do get to the Q&A session, go ahead and introduce yourself when you're prompted. Give us your name, where you work, like if you're outpatient, inpatient, federal qualified health center, that kind of setting, and what your role is in that setting. So without further ado, our guest speaker today is Dr. Kallie Byrd Guimond. She is the principal at Sustainable Influence. She has been a government affairs professional for over 20 years with a focus on integrative health policy. In her work, she has overseen national conventions, congressional briefings, and management of legislation at both the federal and state level. She has experience with direct lobbying, presentation of testimony, bill drafting, grassroots mobilization, shepherding legislation, and legislative tracking. Sustainable Influence is an organization dedicated to leveling the policy playing field by teaching organizations and their members the most effective grassroots and grass tops techniques Sustainable Influence organizes and oversees federal fly-ins and state lobby days, as well as providing guidance for handling state and federal regulatory policies. Okay, so I'm going to pause here and we will just switch over our slides and listen to Kallie. So welcome, Kallie. Thank you very much for being here and presenting with us tonight. Thank you.